We need to have the will to take action. I said at the end of my presentation that we need to be committed to a fairer society, but then we need to take practical steps. And I put that into two parts. One is having the evidence of what works. And that's very important, particularly at a fine university like this one. The part of the core business of the university is gathering the evidence to inform policy and action, evidence of what works. So part of the now what is having the evidence compiled that will make a difference. And the second part is engaging partners. That could be the federal government, it could be the state government, it could be city government, and it may not be government at all. It may be civil society organizations. When I began chairing the Commission on Social Determinants of Health, it seemed to me that if governments weren't interested, we were sunk. What were we going to do? And one of our commissioners, Mirai Chatterjee, who is one of the leaders of the Self-Employed Women's Association in Gujarat in India, said, no, if government won't act, civil society can act. It can do things the government isn't doing, and it can get government to act. Now, recently, I was in Sweden. I've been several times because the Swedes are very interested in this agenda. But the central government in Sweden is unwilling. I went to the parliament and spoke to their social committee. They seemed unwilling, reserved about action. And I said to them, if you don't act, you'll find that every local authority in Sweden is acting. The Association of Local Authorities and Regions, which is a civil society organization, is acting. You'll find that everybody's moving in that direction, and then the central government will have to walk around the front of the queue and pretend they were leading it in the first place. So getting action at local level, getting the buy-in of civil society organizations, hopefully in the US context, getting the buy-in at state level, will push the federal government to act. Because my primitive understanding of US politics is there's only so much the federal government can do anyway. A lot of it has to happen at the state and city level. So getting the right partners, but from my point of view, it's absolutely key having the solid evidence base so you know what you're talking about and you can defend it. A key question is, where should our responsibility lie? Should, for example, here, responsibility be with the citizens of East Baltimore, of Maryland, of the United States, or the globe? And I don't have a strong moral view as to the right place to act. Some of your students and graduates and staff will want to be acting globally. They'll be interested in global health. They'll be seeing a moral reason for trying to help the most disadvantaged in the world. And that's fine. And I don't have a strong prescription. I would never say act globally, not locally, or act locally, not globally. There'll be some who are committed to global health, and there'll be some who are committed to the communities in which they live and work. Acting locally has the big advantage, of course, that you can partner with local groups. And whether local is in Baltimore or local is in Nairobi in Kenya or somewhere else, you can partner with local groups. So there is a tension as to knowing where the right level of action should be. And my response is it should be wherever you can find the receptors. I tried offering my children guidance and failed miserably, so I would never presume to tell young people what to do. As I say, I failed miserably at home. My kids went their own way. I'm delighted with the way they've gone, but it isn't the way I chose, so that's not that. So guidance. Yeah, I mean, you asked me, should doctors, nurses, public health, working nationally or abroad. All of those are possibilities. What I can tell you is what I see as the way forward. And what I see, but this is very personal, is the combination of having the best possible evidence and having the absolute commitment to make a difference. Now, personally, working in Britain for 18 years under a Conservative government, there was no will to take forward action on addressing health inequalities. So I was a researcher. You could say I was doing pure research. I'm delighted that I did do it, because now I feel I understand the evidence base. So when there is a will, and under the Labour government and now under the Conservative-led coalition government in Britain and in various European countries and countries outside Europe, where there is a will, we can work with them with the best evidence base. So having said, I would never tell any young person what they should do. But what I would say is one route is to make sure you have solid facts behind you. You have the best evidence base. So listening to what some of our politicians say in your country and in mine, facts never cross their minds. Evidence never enters into the debate. We don't want to be like that. We want to say, what's the best evidence? And I was asked the other day by somebody, I'm on some global commission for global health governance, and somebody from one country said to me, but wouldn't you tell the politicians X if X made it more likely that they would accept your recommendation? And I said, no. If I knew X not to be true, I would not say it, even if it made them more likely to accept my recommendation. Because next time, I'm not a credible witness. I'll say whatever's necessary to win the argument of today. I think I lose the battle if I win the argument by saying something that isn't true. So my advice to young people, if I were to give any advice, is make sure you're always arguing from as close as you can get to unimpeachable evidence, to a solid evidence base, and then have the passion really to make a difference.